The following program was provided by an independent producer solely responsible for its content. The opinions expressed do not necessarily represent the views of this station, its staff, board of directors, or underwriters.
Welcome to the Empower Hour with Greater Nashua Mental Health. The Empower Hour will provide information and support about mental health, substance use, and behavioral health. Our goal is to share inspiring stories about transforming lives, to strike down stigma, and to encourage our community to reach out and get help when needed. Mental health is part of all of our lives. It's time we talk about it. I'm Dr. Cynthia Whitaker, President and CEO of Greater Nashua Mental Health, and it's time to get empowered. Welcome to the Empower Hour with Greater Nashua Mental Health. I'm Dr. Cynthia Whitaker, the President and CEO of Greater Nashua Mental Health, where you know we have lots of mental health services for individuals all across the lifespan, including some very specialty programs, like the one we're going to talk about today. Today's guest is Dr. Marie Macedonia, who's the coordinator of our Integrated Dual Disorders Treatment Team. I'd like to welcome you to the show today, Marie. Thank you for being here with me.
Thank you, Cynthia. It's a very big pleasure for me to be here.
So I would love for us to start wherever you want to start. But since I already sort of gave a preview around integrated dual disorders treatment, maybe we should start with defining what that is.
So our program is a wonderful program that was started a little bit over 3 years ago at Greater Nashua Mental Health. It's only the second program of this sort in the state of New Hampshire. The first one was open in Manchester, and then our company decided to have a pilot. Let's give it a try. Let's see how we can help our population. And it's dedicated, really focused on people who are both have severe mental illness and concurring substance use disorders. So when people are struggling with both mental illness and addictions, then they come to us and we're able to help them wherever they're at.
So what makes that program different than, say, if somebody was getting treatment for a mental health challenge and a substance use disorder? What makes this program, the Integrated Dual Disorders Treatment Team, a little bit different?
So there's a couple of points that are making it different. One of them is, in the past, traditional treatments were more sequential. Facilities would try to address first the mental illness or the addiction, and thinking if we can bring down the symptoms of the first one, then we can address the second one. This is a concurrent treatment. We treat both mental illness and addiction at the same time. And it is very efficient because, if people are using substance use because of a mental illness, it's only going to exacerbate, but it's also how they cope with their symptoms from the mental illness. So if we can work both the symptoms from the mental illness and the addiction together, we can actually help clients to make progress and take steps toward their recovery. Another important part is that we are outreach. People do not have to come to our office to be seen, which really increase their attendance to appointments. We meet people where they're at. And it's not just physically, geographically, it's also psychologically. We follow different stage of recovery, of engagement, treatment, and we meet people in houses, in shelters, in hospitals, in the park, permitting the weather is good. But we really meet where they're at. And it also comes down to where they are as far as engagement. Initially, people might not want to talk to us. They might agree to the treatment, but they might not want to see case managers and functional support staff and a psychologist or therapist. But that's where we start. We help them with what they need first. A lot of our clients are homeless. A lot of our clients do not have access to food. they do not have support in the community. So we help them with housing. We help them with having access to regular meals or going to the food pantry for them. We help them making appointments with doctors so we can make sure that their physical health is also taken in consideration. If we can rule out a physical condition, a medical condition that is perhaps exacerbating other symptoms, psychological symptoms, we should do this. So that's what we do. We go in the street, in the trenches, if you will, and we go meet people where they're at.
And it sounds like, so meeting people where they're at geographically, meeting people where they're at psychologically, and also where they're at in terms of their needs.
Absolutely.
It sounds like, so like the whole person, whatever needs they have.
It's a very holistic approach.
Yeah.
We also become their support system. We work as a team. And it means that every client knows everybody in our team. We're a team of 5 people right now, but every client knows who Danielle is, who Rick is, and if I cannot see a client, then they can step in and help this client. We can see clients every day if we have to, and in early stages, in acute cases, we often have to see clients every single day. And this is not really a luxury that a lot of other programs have. I think the outreach part is also a lot of programs do not have this available to their clients. It had proven to be very efficient. And clients, when you help somebody finding housing, helping them finding food, having somebody to talk to, there is a strong bond that is created between client and staff. And it's an excellent therapeutic bond, which at the beginning, might just be taking care of housing, but at some point we'll come to talk about addiction and mental illness. And when they are ready then to take those steps toward recovery, here we are. We have been ready all along for you. Cynthia, I got to share something I tell to my clients. And I remind my staff all the time, is that we are keeper of hope.
Yes.
And I say that to my clients every time because I know people usually come to us in a place that is very dark, very desperate, hopeless. They have been rejected often by their family due to their addiction or their mental illness. And I tell them, I know you cannot see hope right now, but I can. And I am going to be keeping that hope for you. I'm going to hold it. I'm going to be walking next to you. And someday you'll realize that you're going to start seeing hope. It's going to be like the end of the tunnel. And you're going to start holding hope a little bit for yourself. But I will still be walking that path with you step by step. And I tell them, and at some point you'll be like a fledgling. You're going to be able to take some steps on your own. I said, I'm never going to be in front of you. I'll be beside you, a little bit behind you. I said, someday you'll see that you'll be able to have hope for yourself. You'll be able to have a job. You'll be able to hold on to your recovery, your sobriety, and you will not need me anymore. And you'd be surprised how many clients, when we graduate them, ask me, do you remember what you told me at the beginning? And of course, it's been like 3 years, like, not exactly, but help me refresh my memory. She said, you said you'd be the keeper of hope. She said, I think I'm ready to hold on to hope for myself.
That's so beautiful.
Yeah. But that describes what we do.
Yeah. And you're holding that hope at a time when people can't see it, can't feel it themselves because of the challenges that they've had.
Installing hope is a great part of recovery. If you cannot believe or believe that somebody next to you believe in hope, there is not much of a reason to take another step in front of the other.
Right.
So if we can install hope, then a good part of the battle is won.
Yeah.
It takes a while. It takes trust. It takes persistence. And that's something that we do. We do not give up on clients. That's why our engagement, sometimes, we can be knocking on the door for 2, 3, 4 months, hoping they will answer. And one day they will. So you're so persistent. I will let you in. But it's not always the same path. Some people are very ready to engage right away. Other people are very ambivalent because they're coping skills, the alcohol, drugs, even poor coping skills have helped them all along in their lives.
Right, and without that hope or being able to hold it themselves, the fear might take over, right? But hope kind of quiets that fear.
Right, and to know that you have somebody there for you all the time.
No matter what.
No matter what. There is no judgment. It's very important, I think, especially in an age where there's so much stigma around mental illness, around addiction. And we see that stigma even in agencies around us who treat clients. And I think it's important to remind clients that you are a human being. You are struggling with a disorder, with a disease. We are going to help you, but you are a human being who deserves respect, who deserves care, who deserves love. It's very Rogerian. It's very unconditional.
And that it must take a certain person to be able to do that, right? I mean, what you're describing is somebody with significant mental illness and significant substance use challenges. And, you know, you're saying sometimes even other agencies, other professionals have a hard time holding hope or seeing that. So what do you do with the staff to make sure the staff can keep holding that hope?
Well, I think a sign of good leadership is to be able to do this for staff as well, to support them, to make sure that they take good care of themselves, and to be there to listen to them, to support them. And a big part for me was to be able to be in the trenches with them. If you have a leader who walks the walk and talk the talk, there is more respect, there is more trust. And I am always ready to listen. My door is always open. After hour, it's always open. Just let's talk. If you have an issue, how can I help you to alleviate that problem? I also remind them that compassion is a huge part of our work. If we offer it to our clients, it's even more important to have self-compassion.
Agree. Yeah.
And that's something, I mean, they know. They say, yeah, Marie is a broken record. But so far, we have been able to have a staff that has been very steadfast. Some have been there now for 2 years. Nobody has been here less than 1 year, even through the pandemic.
That's great. Yeah. Two things are sort of running through my mind. One is my favorite definition of compassion is the suspension of judgment. Right. And so, you know, so we're not judging our clients, but we're also not judging ourselves in that example of with the staff of, you know. And so if I have a moment where I'm judging, well, then I don't judge myself and I just get the support I need and I move on.
Absolutely.
You know, so that's just one thing that was running through my head. And then the other thing I was thinking is you also previously mentioned that the clients know all of the staff. And so I'm sure there's also comfort in that for the staff that like if I need a tap out or if it's just too much, I can rely on my team too.
Absolutely. And that's why I have encouraged all along good communication, healthy communication. Be transparent about your emotion with your colleagues. Let's talk things out and to bond. We are a very tight-knit little family within our big family, the family of GNMH, but IDDT is its own little branch, you know, in family. But it is very important to know that if at some point there are frustration, there is fatigue, because we want to look at the first symptoms for compassion fatigue, virtual secondary traumatization. We just want to be very aware, and I think it's a part of being a good leader. You want to make sure your staff remains healthy, and you need to be on the lookout for those things, and to teach them to be on the lookout for themselves. So when I have a staff who's starting to just express disgruntled feelings toward situation or even client, I said, okay, well, let's ask so-and-so to just take over that situation for today and tomorrow. And let's revisit together what about this situation is frustrating. You know, I think you do not work with a population like we do and coming from different paths of life without experiencing transference and counter-transference. And, you know, my team as all have walked path of life where they have known about addiction, not personally sometimes, but just among their close friends, family, they have witnessed it, and mental illness issues. And so it can be very easy to come in a situation and say, oh, I have to remember this is not my son. I need to distance myself from this situation. And why is this triggering such feeling in me? And so we discuss this in supervision, which I have with every staff, an hour a week for everybody.
What I love about what you're describing is you're helping staff, yourself, all of us, to just be open about whatever's going on, right? So it's not a weakness of a therapist to talk about transference, or, you know, that situation reminds me of my brother or my mother or whatever it might be. And it's not a weakness. In fact, it would be a weakness if we don't talk about it, because then it gets in the way. And so I love, it sounds like this team has really embraced transparency with you as their leader, but it sounds like even maybe with one another.
Absolutely. And you know, transparency and being able to be vulnerable with each other is important, because we are taking care of clients who are very acute. And it comes with a lot of stress when we spend hours in an ER with a client, or if there is an overdose, or if there is a very stressful situation. We need to be able to be transparent with each other. And if there is even a little resentment about the situation, we need to bring it at the table right away. But you cannot be vulnerable if you do not trust the people. And I am happy to see that we have succeeded to create an environment where they can vent a situation appropriately, you know, and in a nice way with each other. And if there is a worry, we can say, this is a family. Families have hurdles. We'll be fine.
Right. We'll figure out a way to get through it.
We'll figure it out. But it was important for me also as a leader to model vulnerability, appropriate vulnerability. I don't think it would be big help for my staff if I was just to cry on their shoulders about issues here and there. But it's absolutely appropriate to show that in a situation, this situation has impacted me emotionally. Here is I feel. And if you notice me acting this way or that way, I can tell you it's because I am feeling this sad at this moment. And they do not see it as a weakness on the part. They just feel more comfortable that if my boss is able to do this, to show this, to share this, then it's okay for me to do so as well. And I think that's why we were able to make it through the pandemic and make our program flourish through a pandemic. It still blows my mind. We went through a pandemic and we were able to thrive. Our program thrived, clients thrived because we were there for them. I think it's a testimony of how well we have worked together.
And I'm almost like envisioning this like cascade of thriving, right? So your ability as a leader to be vulnerable, to build that trust, allows your staff to be vulnerable and to build trust, allows the clients to be vulnerable and to have trust with your team. I mean, it's just this cascading light, or, you know, however you might want to describe it or see it. And
well, absolutely. You know, I think that is very important, what approach we have to our work, to our colleagues, to remain, we can't just be Pollyanna and fake happiness. And we have to be genuine about it. And because it's all genuine, the support is genuine, the expression of emotions is very genuine, I think we're able to create that cascade of bounty, of goodness, of support. And especially at a time when we all needed it so much.
yeah,
And it's contagious.
it is.
Positivity, kindness, goodness is very contagious. And I always challenge people, why don't we try to spread a little happiness today? Let's be contagious about that.
So you mentioned thriving and flourishing despite the pandemic. Do you have any examples of that, or is there a story in there somewhere?
Well, you know, it was interesting when the news of the pandemic happened, I had to go home early because I was at risk. Because of a medical condition, I was really at risk, and we didn't know what was happening exactly. So I had to work remotely, and for the 3 first months, everybody was remote. We were trying to learn about telehealth. We were trying to call our clients every single day, are you okay? What can we do from here? And very soon, very quickly, we actually went back into a community. Like by June, 3 months after, we were back on the ground. But despite all those challenges, we had clients graduating, and I remember I'm going to share a little bit about a client because she graduated during a pandemic. And how fair is that? You can't really have a celebration. But she would still come to the office, and when we were allowed to have people back, otherwise I would meet her outside, and we had our mask and PPE and all of this. But I remember 3 years ago, when I started with this client, she would come to appointments, but she would drink in the bathroom before the appointment. So she would come to my room inebriated. And I would take her home. I would literally say, you know what, why don't we take you home, set you comfortably, and we'll talk more about this. And there was ups and downs, like any path to recovery. I showed her acceptance. I never gave up. At some point, she had a lot of problem with her family as well, as a lot of our clients do. And she felt very isolated. She had lost her children due to substance use. She was rejected by her family. She had no housing. But after, we drove her to Farnham, to the detox center, and I drove her up north to Farnham North in Franklin. And little by little, she said, I think I can do this. And she met people in the team. She was doing supported employment with somebody. She had another case manager. So we were talking with her almost every day, doing something with her, encouraging her, helping her to have that hope that she could once again have a home, that if she wanted to adopt a cat, she could. She wanted to see her children, she felt like she could. And it took us 3 years. This is not a short-term program. And I'll talk more about this. But, through the pandemic, we were able to help her have a job, stabilize her mental health. She reached 18 months of sobriety.
Wow.
She was able to secure an apartment. She got back her driver's license, which, as we know, after you had a couple of DUIs, it's very hard to get back a driver's license.
It takes a lot of work.
A lot of work, but she was very, very committed at this point. And it was amazing to see her coming from a place where she was drunk, coming to an appointment where I literally take her home, tuck her on her couch, and say, it's going to be okay. We're going to make it through this. And every time she said, don't give up on me, don't give up. To tell her, you don't have to worry about this. I'm not going anywhere. We, as a team, are not going anywhere. And it was beautiful when she was one of the people who remember me holding hope. And she said, Marie, I think I'm ready to move on. I think I'm ready to hold on my 2 feet and hold on to hope. And we had then, every 2 weeks appointment. We started to work toward graduation every month. And one day she said, she was sad, she said, I think I'm ready. I think we can stop now. And she was flourishing. And what is so beautiful about this is that I just got an email from her. She actually sent me an email, and she sent me an email of a picture of her at her son's graduation. She had not seen her son in so many years. She was so proud. She said, that was my goal. I drove down to that state, and I was able to sit with all my children and be at one of their graduation. And she was so, so proud of herself. And I was so proud of herself. And she said, thank you. She said, thank you so much. I will pray for you. She's a very religious person, but she was saying, I could not have made it without your team. And sometimes I think even as we take it a little bit for granted, because we are in the trenches every day, we don't always see the outcome. We wish we could see people, embrace change right away, but it takes a long time. But I paused and say, oh my gosh, she regained her life. She just got her life back, including her children, the respect of her ex-husband. It was huge. She's healing bonds, healing relationship with her family who had rejected her for so long. So this is what keeps us going when you know that a program is working. Even if it takes a long time, it just saved a life.
Yeah.
That's no small thing.
No small thing at all.
No small thing. And, I talk about time, but this program, this IDDT model, really has shown to work for 60% of clients over a period of 3 to 5 years.
60%.
60% of people who have increased functionality.
Nice.
And this is threefold more than any kind of traditional program. And I think that's why, when we first started the program, we were not sure exactly how to implement it. And we had to find our sea legs.
We sure did.
And the first year was about that, but we made it through. And the second year there was a pandemic, and that was that. And look at us now. We are just really graduating people. We have people who reach sobriety, stability with us, and then they decide to become a recovery coach.
Right. And then help other people on
And
their
they
journey.
help other people.
Yeah, there's more of that ripple effect.
Absolutely. But that's what is so beautiful. It's that most of the clients I've seen are not selfish about what they're experiencing because it feels so good for them to regain their life, to their dignity, their confidence, their independence, that they feel I can help someone else. And so many times I hear people say, well, how can I help? And we always turn them to what peer recovery, Your story can help others. Your experience can help others. And I think it just shows that people in general are good.
Yeah.
They want to help each other.
Well, and there's more of that vulnerability and authenticity just kind of spiraling from staff to clients, then clients to helping others to, whatever it might be.
Yes.
So you mentioned graduation. So clients graduate from IDDT, and that can mean ending treatment completely. It can mean maybe staying in mental health treatment to keep the mental health symptoms kind of in check. What does graduation look like?
That's a very good question because every case is different. And all of our clients have very severe mental illness. And for some of them, it means that they will be in treatment probably for the rest of their life, but it doesn't mean they have to be at that level of intensive care.
Right.
So when a client has reached sobriety, and that includes both substance use and stability as far as mental illness, we wait 18 months. They must be sober for 18 months and stable for 18 months to 2 years in order to qualify for graduation. Now, if clients want to have a psychiatrist with us, go to Greater Nashua, and will probably remain on medication, then we can graduate them down to more of a community service level, to CSS, which they can be low utilizers. So that can be seeing a case manager once a month, once every 3 months, but still have access to the psychiatrist for prescription and just monitoring what's happening. Those are the most severe cases. Some clients feel that once they have reached that point of recovery, they can have a psychiatrist in the community and they just decide, I'm good. This person is going to prescribe me my medication and we can go our different ways. For other clients, it can be that they don't need medication. And when they graduate, it's really like, oh my gosh, I just regained my life. I'm doing well. So it depends, the level, the severity of a case. It depends also what medications they are taking. There is a shortage of prescribers.
Right.
And that is, I think, in a lot of states, but we see it every day. So if a client is thriving under the care of one of our psychiatrists and can be seen as a low utilizer and still enjoy those services, it's to the benefit of the client.
Right. So where it's not, oh, you're doing better, good luck. You're working individually with each client to create the best plan for them to sustain their recovery.
Absolutely. This is the plan. This is aftercare. You know, it's not about just reaching sobriety. It's to make sure the client has the tools and the resources to maintain that sobriety, to maintain the gains made in therapy and in treatment. That's what sets them up really in the long term to be successful, to move on with life. And the door is always open. If something happened, clients has difficulties, they can come through our open access.
Come back again.
And come back again. Yeah. So it's not like we close the door and say we're done. No. We know that, you know, sobriety is a lifelong process. And coping with mental health truly is as well.
Right.
So we make sure that our clients are very stable, and that can include different things. It can be, can they maintain housing? Can they maintain a job? Are they able to access to the resources that are going to help them support their gains? But we take a while to discharge clients to make sure that we are not just pushing them out of the door and then they would relapse quickly. You know, we want to make sure they have support in the community, like Hearts, Revive, AA, NA, different association that they can use as a sober support.
All right, so that there's other supports too.
Yes, we work well with all the agencies in our community.
Yeah.
I think that's how we can serve our clients the best, and I truly mean serving, because we need to provide them with great care. I think that's something that I was really installed in me by a professor in college, in undergrad. It was a class called Community Mental Health. I didn't know what I was taking. Say, sure, it's 3 credits, I'll take it. And it happened to be a revelation for me. But when he talked about the population that need the most support, this is truly the population we serve, community mental health.
Yeah, I love that you just went there, because I was like, oh, I think it would be great for people to sort of hear more about you, because clearly we're hearing just how much care and concern and compassion, right? The non-judgment that you have for clients. So how did you come to really want to be working kind of with what I think many people would shy away from? You know, they want to be in the office. They want clients to come to them. I mean, you're a psychologist, you know?
Right.
So
Yes.
what other than that bachelor's class that instilled that in you, what else? How else did you get here?
Well, I've always wanted to help people. Since I was a child, I had a drive to help, to give. The big thing was all my life I wanted to alleviate pain. Any pain. It was a big deal for me, for animals, for people, since I was a very small child. And I've done that through my life. But when I started to discover psychology, I figured that could be a platform. Now, when I started my undergraduate, I started later in life. I had raised my children. I came from different paths of life myself. I was an immigrant. I had to work hard, and I could not afford to go to school until later in life. But first of all, I realized during the bachelor's degree that psychology is fantastic, that I really was interested, fascinated by the subject. And then I got mentors along the way. I went to Plymouth State University, and one of the professors in the graduate program, I had a semester with her for a graduate degree, and she said, Marie, why don't you go for a doctorate degree? And she was kind. She said, you're not a spring chicken anymore, as well jumping on the doctorate degree right away, which I did. And I went to Antioch University in New England, in Keene actually, and it's such a wonderful school because it's about social justice and it's about a practitioner. You're a researcher, but you're a practitioner, you know. So while I was getting all this education, you know, very clinical education, I was doing a dissertation, I was also serving practicums every year from the very beginning. And my first practicum was in neuropsychology, which I still love to this day. I can be a psychometrician. But after that, I started to work with people from the community. And I worked in a pastoral counseling center, working with people who could not afford to see a psychologist. And I was training under this banner of we will take you in, we will help you. And I worked in impoverished school. I worked in one of my training was in the Fitchburg High School, where 80% of the kids were on free meals because it's so poor. And by having those experiences with people from the community, I ended up going to my pre-doctoral internship to Luck, a community mental health center in Fitchburg. And it was a wonderful experience because it showed me that I loved working in the community. And I can work in an office, but there is nothing like going to see somebody at their house or meeting them in a park or just, hey, you know what? I'll meet you at the shelter and see where they are, learn from their family, see how their family look at them, what they have or don't have. And it's humbling, but it makes me feel like I'm actually serving a good cause. And it really reverberated the words from my professor, Dr. McDougall, who said, Marie, I've been in private practice, but he said the real work is in the community. It truly is. And after Luck, I said, well, this is what I love to do. And I got my postdoctoral internship fellowship at Greater Nashua Mental Health. And I've been here for 3 years now.
I know.
And
So great.
serving. And, at some point I was getting, I think, some slack back about not, you're a coordinator, you can be in the office. But when I am with IDDT, you need to model. You need to show, because any team, if you do not show by example that you can walk what they are doing every day, they will not have that respect and that trust. But I love the work in the community. I really do. Meeting the family, meeting the cats. Everybody has cats. It's wonderful.
Well, you and I certainly shared that love. I mean, Antioch, but just social justice and community, and we have a lot in common with that. So we're just so delighted that you're on our team and here. And
thank you. And the platform, I'm thinking about the platform. When you have an education, sometimes it can give you more of a platform to help your population.
Yeah, I agree.
And I truly use it when it comes down to talk about stigmatization, about, co-occurring disorder, substance use. I use it in the community, in agencies, to attract the attention on this is still a person that we're treating here. Let's talk about this.
Yeah, and for me, it's like, I was given the privilege to have this degree and this education. How do I use it to serve and whatever's best for whoever I'm with in the moment? Right?
Absolutely. Yes, I feel that way exactly.
What you are describing, it's just, it's our mission, right? Empowering people also sometimes means sharing wisdom or sharing our experiences too.
And it's important, when we share our wisdom and our experience, because we have to be credible to our clients. And sometimes it has to be appropriate, of course, to self-disclose information. We don't want to give too many personal information, but it's okay at times to share, this is a path that is going to get better, and I can tell you this, you may not believe it, and say things like this that help them. Say, really? I said, yes. So it gives us credibility that we're not just on an ivory tower.
Exactly.
Unreachable. How can you help me if you don't understand me?
Right. People don't, right? I mean, if we've been talking about trust and authenticity. If you don't feel safe with somebody, if you don't feel like they can meet you where you're at because you can't get it, we're not going to be able to have the same level of impact. So yeah, I love what you're saying. We would be remiss if we didn't mention how this program came to be at Greater Nashua. So you mentioned it's been up and running for about 3 years, and it came to be because of the state of New Hampshire and the 1115 waiver, the IDN, the integrated delivery networks being set up all across the state. And they provided us some funding to start the program. And I know a lot of people have been asking, oh, with the IDNs ending, because that program is timing out, are we keeping this program? And, I think it's important for us to say yes, just for all the reasons you've described, that we've seen the impact, people graduating who've been in our system or in the mental health system for a long time and not received that substance use and mental health at the same time treatment, and now doing much better. So anyway, I just kind of wanted to make sure we said that.
Absolutely. It was such a leap of faith, for the idea, and say, let's see what we can do with this program. But after 3 years, just 3 years of implementation, we have met fidelity, and which means that we are making all the check marks of what we were supposed to accomplish in our program. But we're able also to help people heal. And when people heal, there's less stress on the funds in a community. They are not accessing hospital care as much. They are not in the ER every week. They are not draining some resources at that point, because they are able to care for themselves. They're able to just function.
Get a job, even help other people, right?
Absolutely. Yeah. So I think it's if you help somebody, to just reach that level where they are comfortable with their life, they believe they can do it. Yeah. They are healthy.
I can't imagine turning back, right? We've just seen.
We have had so many successes, so many stories, and people who are going to be graduating this summer as well, that I've known now for, it will be over 3 years, and who have been able to raise their children. Children were not taken away by the state.
Right.
They're able to keep their children. Yeah. And for me, that's just such a testimony of what we can do as a team to help people help themselves.
Yeah, I think we're getting at that point, because like you said, the fidelity is 3 to 5 years, and continuing to support people in their initial phase of sobriety so that they learn the tools to maintain it. Right. We're really at the cusp of seeing a lot of success and graduation.
Yes. And it's beautiful, because every month, I share with you our success story of the month. But for me, it's always a good moment to sit down and say, oh yeah, and this happened with this client, and this with this. And we have a team meeting every morning, and we share those successes. This is our wins. And we hold on to those wins, because little win by little win, we can get to big wins.
Exactly. And it keeps holding the hope,
yes.
Right? When we focus on the successes, and we focus on what's going right, and knowing that every human being deserves the success.
They do. They really, really do. And they deserve to believe that people can believe in them. They need to believe, and to know that people believe that they can have a second chance, sometimes a third one, fourth, fifth, sixth chance. Who's going to count? I've seen people going to a sobriety center for 15, 16, 17 times in just 5 years, right? And that 17 times was the charm. That's why I say, okay, I'm ready to listen now.
Right, that's why we never give up, right?
That's right, we don't give up. We can't give up on human life. And that's what we do, we save lives. So
it makes me think about the human spirit, right? Like you are just, you're recognizing the beauty of the human spirit is within everyone, regardless of their circumstances and situations, even when they can't see it. That's what I see.
Yes, well, I do believe that we see a spark of the divine, whatever his, her names is, in every human being, and I think we need to be conscious of that. When we meet somebody, we cannot just make the assumption, this is manipulation, this is this and that, very negative. No, let's look at what is good. Let's look at what this person really wants. There's a beautiful picture I've seen on the internet, and it's about two human beings, and it's the statues. It's made of mesh. They have their back turned to each other. They sounds like they had an argument. And there's the inner child in each person that is facing and trying to reach each other through the mesh. And I think that's what we do when we meet our clients every day.
beautiful image.
You know, we are reaching from within. We are not, we cannot ignore the fact of the addiction or what has happened, but we do not have to stop there. We need to go further and look deeper. Reach out to each other. And if you reach out to somebody, they will reach back.
And I think it's easier for us than it is for some family members. Right? I think because family members have been personally hurt, or it's really hard to see your family member suffer. It's sometimes hard for families to keep holding the hope. And so sometimes we're holding the hope for families as well.
Oh, absolutely. We work with families. You know, if one of my staff sees a client, I will often meet with one of the parents or sisters, and we will help them. It's not about talking about the client behind their back. It's about helping the family to understand better the path of the client, the addiction, normalize their experience, validate their emotion, but also help them to maybe see further as well. You know, if I help you lower your anxiety, can you maybe interact with that person with a little bit less anger?
Right.
And resentment, and how can we just bring you together?
Yeah, I also hear a little bit when you say that of like resetting expectations. I've seen a lot of families over the years where they're like, you know, they're going to treatment and, you know, they're going to be better in, you know, 7 days or 28 days. And, you know, clearly IDDT is like, no, this is a journey and then it takes time, and let's focus on the progress. And so I think I've often heard stories about helping family members or other loved ones just shift their perspective about the expectation, which also then allows them to engage different.
Oh yes, education is so important.
Yeah, exactly.
I mean, for all of us, but for families who have been suffering, there has been so true suffering, you know, and because there is also the grief to have lost that loved one to the drugs. You know, they are not dead, but they are like dead to them at some point, and they're angry.
Sometimes,
And it can be very difficult, but to reset, saying we cannot work a miracle in a week, but all together, over time, we may make some progress, and we can
plant
try.
seeds for miracles.
We can. The mustard seed, absolutely.
Yeah, exactly. Oh, well, I can't even believe how fast this time went by, and it's just been a delight to spend time with you in person. I've seen you some on the screen in this past year, but what a delight to just be sitting with you and talking about, you know, the fabulous success that this program has had, and I'm so grateful we got to implement it, and to have you be its leader has just been a delight. So,
well, thank you. This has been a wonderful opportunity to talk about the program, to talk about the population I love, really, and to brag about my team, because they are quite extraordinary as well.
Yeah,
so
it's a great team with a great leader, and thank you for watching the Empower Hour with Greater Nashville Mental Health. And should you have concerns or have a family member with concerns, Dr. Macedonia is the leader of only one of our many programs, and we are here to help, and we hold out hope for whoever is in our community that needs us. So thank you for watching, and have an empowered day.
The preceding program was provided by an independent producer solely responsible for its content. The opinions expressed do not necessarily represent the views of this station, its staff, board of directors, or underwriters.